and we can get the gathering started. On behalf of Access to Integrative Medicine, also known as AIM Health Institute, and the GW Office of Integrative Medicine and Health, thank you for deciding to spend a little bit of your Friday afternoon with us during A Mindfulness Experience. AIM is a nonprofit organization with the mission to provide vulnerable and low-income communities with access to whole person health and wellness. GW's Office of Integrative Medicine and Health provides professional development, education, and community outreach to improve health and wellness. Today's facilitators are GW's own Richard Nkwenti, who is a pharmacist and a graduate of our master's degree level program in integrative medicine, and a whole other assortment of initials after Richard's name, and Dr. Deirdre Orceyre, who is a naturopath, and she an acupuncturist, and she too has an assortment of letters behind her name. And anyone who is a patient at GW Center for Integrative Medicine will know Deirdre, but we all need to make a point of knowing Deirdre because she's also amazing. So Dr. Nkwenti will give us a wellness talk, and Dr. Orceyre will do a mind-body session on acupressure, which people asked for a few weeks ago, but coincidentally, we had already scheduled this. So I'm very happy to be able to provide this to you today. So I will now turn things over to Richard.
All right. Thanks. Thank you all for giving me the opportunity to give my overview of wellness talk on the COVID-19 pandemic, which has actually taken the world by storm. I would I have a slide presentation that I want to share with all of you. It's pretty long, but I'll try to go through the main areas of the slide. Let me see if you can, okay, let me see. All right, so my presentation is on COVID-19 pandemic and how we can fight this virus and its associated complications. All right. So I already thank you guys for the invitation to give my input on COVID-19 pandemic, which has taken the world by storm. Looking at the current literature regarding the COVID-19 and the associated deaths, we see that it follows a particular trend. Individuals with vastly deficient immune system are at serious risk. There is an inflammatory component of this disease that we must look at, and our ability to modulate the immune system is the only way out of staying safe from contracting this virus and rapid recovery from viral attack. Currently, there is no vaccine approved for use. Even with a vaccine, we still need to naturally boost our immune system. It is therefore our role as integrative professionals to embark on those health strategies to help the immune system function to the max. With that said, I will go over a few dietary supplements that I have critically looked at, both from a literature review standpoint and a product formulation standpoint. Then secondly, I will look at some hormone-related strategies that physicians can use to improve health outcomes and possibly boost their patient's immune system and disease-fighting capability in viruses. There is a great need for society today than ever before to embark on the best method possible of administering a vital nutrient for the body, due to the fact that many products are either poorly absorbed in the stomach, leading to very little availability. Okay, as an integrative medicine professional who is also a product formulation pharmacist, my role is to educate providers about the appropriate dosage forms that could yield maximum benefits their patient's health condition through formulating products that get to target tissues and organs to elicit action. That's my role as a product formulation scientist with deep understanding of the anti-aging, integrative, and functional aspects of the disease and chronic, especially when it comes to chronic conditions. With this in mind, I will, at the end of my discussion, talk about liposomal formulations and what they can do for COVID-19 immune boosting, particularly vitamin C and glutathione. Cytokine storm, as we all know, it's now becoming a very big factor in COVID patients. The current narrative on COVID-19 has now been on its ability to cause cytokine storm, which is an excessive immune response to external stimuli. The pathogenesis of cytokine storm is complex and oftentimes poorly understood. The disease progresses rapidly and the mortality is quite high. There are studies in place showing that in most COVID-19 patients, severe deterioration of symptoms and eventual death has been closely related to occurrence of cytokine storm in their bodies. So cytokine storms, what cytokines affect the cytokine storm phenomena? Involved in this, we have like interferons, interleukins. There are the colony stimulating factors and the tumor necrosis factor, which is perhaps the best known and most intensely studied of the pro-inflammatory cytokines. And it plays a prominent role in cytokine storm literature. Excess TNF production is associated with a number of chronic inflammatory and autoimmune diseases. And TNF inhibitors have been approved for the treatment of inflammatory bowel disease, psoriasis, and rheumatoid arthritis. With that introduction, I am going to go over a few of the recent studies that have actually been found to be able to stop the cytokine storm phenomenon. And most of those studies have actually been done within the past 3 or 4 months during the pandemic, when the pandemic actually started. And amongst one of those is vitamin D. Low levels of vitamin D is reported in a number of health problems, including cardiovascular, insulin resistance, and diabetes. Both type 1 and 2, autoimmune disorders, obesity, and vitamin D also plays a role in production of estrogen in men by helping maintain calcium homeostasis and also expression of aromatase gene. So when we look at vitamin D and its role in cytokine storm, we see that given that CRP, which is a C-reactive protein, which is a surrogate marker for cytokine storm and associated with vitamin D deficiency, there are retrospective data that shows evidence of the possible role of vitamin D with aggravating complications of immune disorders due to the fact that the powerful anti-inflammatory actions of vitamin D has the ability to halt inflammation. Most COVID patients come in with inflammation that eventually leads to severe conditions and eventual death. So when we look at cytokine storm, there is damage to the lungs that leads to acute respiratory distress symptom and death in most patients. One of the researchers did a study a couple of months ago, and they found out that there seems to be, the majority of patients with COVID-19 have a destruction of their lungs caused by this virus. So they came to the conclusion that vitamin D helps in not only preventing patients from contracting the virus, they also help in modulating the course of this virus through several different mechanisms. Okay. My current research shows that vitamin D is very, very paramount, especially in the Black population. There were actually a couple of studies done several years ago by a group of researchers, which actually identified the fact that whites have more plasma protein binding than the Black population. And what does that do? When there is more plasma protein binding, it helps to store more vitamin D produced in the sun for eventual use at a later date. So with the white population having the capability to produce vitamin D and store it through more plasma protein binding, whites have the ability to modulate how much vitamin D is available in the system to help them fight a lot of different conditions. Compared to Blacks, there are several different factors, including the melanin in the skin and the available low plasma protein binding, which somehow helps or prevents them from having enough storage forms of vitamin D that can help them combat their immunity. So in essence, whites have the ability to fight infection through a better immune boosting capability than Blacks. And one of those reasons is caused by available vitamin D in the system. And several other studies have been done in the past few weeks involving glutathione and a glutathione precursor called acetylcysteine. Glutathione is a very powerful antioxidant that has the ability to boost the immune system and combat oxidative stress. On the other hand, acetylcysteine is being used in the hospital it's a mucolytic over the counter, and it's also used to combat liver toxicity, especially with acetaminophen. So, but several studies done a couple of weeks, they identified that when glutathione and acetylcysteine are used in combination with some other immune boosters, they are able to stop TNF alpha, interleukin 8, and interleukin 6, which are very, very influential or which play contributory roles in the inflammatory process, especially when it comes to COVID-19. And it has actually helped tremendously in getting some patients from the intensive care unit. And also, when we look at vitamin C, it's shown to have, it's a supplement that increases production of white blood cells, neutrophils, lymphocytes, and natural killer cells, increase levels of antibodies, increase production of interferon, and modulate prostaglandin synthesis and decrease inflammation. The bottom line is vitamin C in an injectable form, it's very, very effective. And it has been shown to have virucidal capabilities. For somebody who cannot get an injection, which is actually a prescription only, liposomal vitamin C is the closest to an injection that as we can get, because of the way it's absorbed. When you take liposomal vitamin C, most of it, about 50%, goes into the bloodstream and elicit action, compared to regular vitamin C, which it's not well absorbed in the stomach. Okay, one other supplement I want to talk to is selenium. Selenium in itself has powerful immune boosting capabilities. When patients are deficient on selenium, they are not able to produce enough antibodies. Also, selenium is one mineral that helps in the conversion of T3 from T4. Americans are heavily hypothyroid. That's why a lot of Americans take levothyroxine, which is actually an inactive form. When you take levothyroxine, it has to be converted into the body to T3, which is the active hormone. And without an abundance of selenium in the system, that conversion doesn't take place. So when we are deficient in selenium, we not only prevent ourselves from enjoying the immune boosting capabilities of selenium, but we also it also leads to a deficiency in T3, which is liothyronine, which is the heart and soul of the thyroid function. So it's important for us to not just concentrate on the vaccine capability, but also try to boost those vital nutrients that help our immunity. Because T3 on itself has been shown by some studies to cause cytokine storm. So by improving the conversion of T4 to T3, we are actually fighting this virus on its own. And another very, very vital nutrient is zinc, which is involved in more than 1,000 different enzymes. So when we boost our zinc capability, we are also boosting our immune system. Then hypothyroidism. Then when we come to the last slide, it's actually hormone balance. Hormone balance in general has been found to have powerful immune boosting capabilities for every man or woman. Progesterone, for example, has anti-inflammatory actions. DHEA has been shown by several studies to have powerful immune boosting capabilities. Testosterone, even though most often we look at testosterone as a male hormone, a lot of women have about 10% of the available testosterone in a man. So testosterone has very powerful anti-inflammatory actions together with immune boosting capabilities that if all these strategies are put together, we are able to successfully not only increase our chances of survival from this virus, but also embark on several different ways on how to lessen the severity of the virus. With that, I end my presentation.
Thank you so much, Richard. Does anybody have any questions for Dr. Nkwenti?
Yes, can you go over again about selenium and the different thyroid hormones?
Okay, pretty much selenium is a vital nutrient, which is very, very important for the immune system. Selenium doesn't only help to boost the immune system, there are several studies that has shown selenium to have virucidal activity on a lot of different viruses. The biomarker for selenium has to be done to be able to see how much selenium is in the system. And most of our thyroid patients, the thyroid patients we see today, most of them are on levothyroxine. Okay, it's very, very difficult at times to get some physicians to even order a T3 level because it's not part of their conventional standards of care. So, but when we don't have enough selenium, we don't have the capability in the body to convert T4 to T3. When we actually take T4, which is the levothyroxine, it's not effective until it is converted in the body to T3, okay? And that conversion, cannot take place without available selenium, available zinc, and available chromium. Those are the three vital nutrients that are very, very important for that conversion to take place. So when that conversion takes place, it forms T3, which is the heart of thyroid hormones, okay? There are actually studies that have been done to show that free T3 level is the single predictor of death in cardiac patients, okay? So when a patient is a cardiac patient and they see the free T3 level is done and the level is quite low, that is the greatest predictor for an anti-aging or functional medicine physician that this patient is at risk for severe consequences. So that's how selenium is very, very important. Even though most conventional doctors, they won't even think about a vital nutrient like selenium when it comes to immune system boosting capabilities.
Okay, so Richard, I'm going to hold any other questions until after the mind-body session. Will you be able to hang around with us?
Yes, yes,
Okay,
absolutely.
excellent, excellent. I'm going to turn everything over to Deirdre now.
Thank you so much. Richard, could you stop sharing your screen? Thank you so much. Great. Hi, everybody. So, lovely to see the people that I know. Lovely to see the people that I'm just meeting for the first time. As Janet said, I'm Dr. Deirdre Orceyre. I work at the GW Center for Integrative Medicine. And today I was planning to do acupressure today, but of course acupressure is a huge topic. So through the wizardry of Janet earlier today, or Lee, one of the two, most people were sent a survey, and we decided that we're going to do acupressure for insomnia. But I will say that most of the points I'm going to do today will work great for stress, for anxiety. They're all relaxing and sedating. So you could use this in the middle of the day if you're feeling worked up and you need a few moments to calm down. You could do it in the morning if you want to start your day in a very calm manner. So I'm not going to be able to look at the chat while I'm talking. So if you have any questions, you can save them for the end unless they're urgent, and then I guess someone else will let me know. So I'm going to start with a PowerPoint. We typed into the chat that if you have some sort of tool you can use for acupressure, that would be great to have that on hand. You can certainly use your fingers. That's no problem. But if you have a tennis ball or a lacrosse ball, or even like even a golf ball would work. Anything that has a little nubbins on it, you know, they sell those little balls at the shoe store, you know, anything like that. You could get that and have that available, or you can just use your fingers. Some of the points are harder to access without a ball, but that's totally okay. So let me share my screen so that we can get my PowerPoint up, and I will definitely make this available for everyone after today. Here we go. Okay. So can everyone see the PowerPoint? Janet or someone, could you unmute and let me know?
We cannot see it.
Oh, you can't?
No, I'm just seeing you.
Oh, okay, let me fix it.
You actually shared your screen?
Oh yeah, but it's giving me a little trouble. So it's just a technology issue. So give me a second. And I will make it work, or I'll start over. Okay, I'm having a technical issue. For some reason, my Zoom screen is completely frozen. So I apologize. I do a ton of these presentations, and this is definitely a technical issue. It's like I think I'm gonna have to log out and come back in. It's like my screen is completely frozen. Or actually, can another one of the hosts grab the screen sharing and see if we can unfreeze it that way?
Okay, I'll do that.
Just try to share your screen and see if it takes it away from me.
Sure.
Thanks. Nope, it's not working.
Okay.
I am totally frozen. I'm really sorry, everybody. These are the moments where we get to practice our mindfulness and our breathing, and just be patient until the technology sorts itself out. I think I'm gonna try.
I just clicked on share screen. I'm one of the attendees. I just clicked on share screen and asked me what I want to share.
Yeah, that's the screen that's frozen for me. It's completely frozen. So, and it won't even let me get back to my Zoom screen. So, Janet, I'm so sorry to do this.
No problem.
I think I'm gonna have to log out and log right back into the meeting. So I'll be right back.
We'll see you
somebody
shortly.
is sharing the screen and they didn't shut it up.
Okay, great. I'm gonna try it one more time. Okay, can you see it?
Yes.
Excellent. All right. So let me start at the beginning. And can you see me? Do you see a little picture of me?
Yes, we can.
Okay, good, because there are a couple things that I want to demonstrate while I have the PowerPoint up. Okay, so this is acupressure for insomnia. And I'll just start by, oh, and Janet, what's my time? How much time do I have for everybody? If you told me.
It would help if I unmuted myself.
Oh, there we go.
Is 20 minutes enough?
Yeah, so about 10 to 3 we'll finish up. Does that sound good?
Sure, sure.
Okay, great. All right. So first, just a little primer on acupuncture versus acupressure. So acupuncture is when we use needles, and you can see in this slide there's a picture of an acupuncture needle in a point that's on between the thumb and the first finger on the hand, and that's when we insert a needle through the skin. That's called acupuncture. When we do acupressure, we're using pressure either from a finger or an elbow or a ball, or we're digging our point into like the back of a chair, any of those techniques, but we're using pressure to push on the point. And as you can imagine, acupuncture is very precise. When I'm doing acupuncture, I am feeling the bones, I'm feeling the muscles, I'm feeling the tendons and ligaments, and I am finding the exact spot. When we do acupressure, one of the beauties of it is that you don't have to be so precise. So as we're going through this today, you don't have to worry about getting the points exactly correct, because you know, the width of a thumb or the width of a tennis ball is pretty broad. And so what we're doing is we're actually putting pressure on the whole area, and that's very effective. So I just want to let you off the hook that you don't have to be a perfectionist today. A couple of things to know: these points release muscular tension just like a massage would, or if you've ever heard of trigger point therapy, that will release muscular tension. They promote circulation into that area. And then in Chinese medicine, so I'm a trained acupuncturist, Chinese medicine practitioner, what we learn is about an energy that the body has, which is called chi. And these days, most people have heard of chi. Most of you have probably heard of it. And you may have questions about what is chi. But you can just think of it sort of like a life force, the way that our breath moves, the way that our blood moves through our vessels, the way that our lymphatic flow moves, the way the impulses move down the nerves. All of that requires chi to make it happen. So it's a kind of life force that our body has. And these points are like wells of chi, or you could think of them as fuses or circuit breakers, where there's a circuit that runs through the body and the chi flows through the circuit. And for whatever reason, either it's too low, like a river that's drying out, or it's blocked, like a dam that blocks a river. And what the acupressure does is it actually brings some chi, some blood flow, some energy to that point, which then opens up the whole channel. So you can treat a point, say, I keep using my hand, you could treat a point on your hand, and it might actually treat a headache, or it might treat menstrual cramps, or it might treat knee pain, because the channels run all through the body. So sometimes people get confused, like how come how come we're working on sleep, but we're doing a point on the ankle? And it's because of those channels of chi and how they can be influenced by these fuses that are called acupressure points or acupuncture points. So the other thing that can happen with acupressure is that endorphins can be released, which is a really nice thing to help us relax, and that's especially good for sleep. So as I mentioned earlier, I have a little picture here of different kinds of balls you can use. It doesn't really matter, and you can play with different types of tools. We have, where'd that thing go? I don't know. Anyway, I have all sorts of things around my house, but there are like lots of little massager tools that have little nubs on them, and really it's about the location, how big it is, and also your body and how sensitive you are. Like for example, a golf ball is really hard, and so you might not like the way that feels on your body. So you might prefer something that has more give to it, like a lacrosse ball or a tennis ball, or vice versa. If you're going to use your fingers, the points I'm showing you today, I'm pretty specific about which fingers to use, but generally the middle finger is the most sensitive. So you could try using your middle finger. The thumb is going to be the strongest, but you can also even use your knuckles to dig into the point. Of course, wear comfortable clothing. And if you're using this for insomnia, you want to do it before bed to get yourself ready for sleeping. Now, different techniques that you can use today, and you can just try these out on your own as we're going through the points. Firm pressure, and you want to apply it steadily and gradually and hold it generally not more than like 30 seconds. I mean, some people who are pretty hardcore will go like a minute and a half, but that's very long. So I'm going to say, somewhere 15 to 30 seconds. And, you just start light and you can go deeper and deeper and just hold it there. So that's one type of technique. You don't want it to hurt. So you shouldn't be trying to cause pain. That means you've gone too far. Sometimes there is a hurt so good feeling, and you kind of know your body likes it. So, that can be okay, but you don't want to be causing a pain sensation that makes you tighten or tense up. That won't help anything. Also, we can do slow motion kneading. This is kind of like just a gentle kneading. And these are all actions that we do intuitively, and we've been doing acupressure, I'm sure, since humans, first touched their shoulders to rub out some tension, or put their fingers to their temples when they had a headache and rubbed. That's all acupressure. And so your body, you intuitively know what to do a lot of times. Sometimes we also do like a rubbing sensation or a quick tapping. In Chinese medicine, we call this chicken pecking technique. So you just take like your 3 fingers and tap, tap, tap. That's something that we do in shiatsu too. You might notice some tension, some soreness, that hurts so good feeling. More is not better. As soon as you feel a sort of flooding of endorphins or a relaxation sensation, you're good to go. You can stop, or you can just hold where you are. If you have referred pain or something doesn't seem right, then just stop doing it, especially today because I'm not with you and I can't observe whether, you know, you might need some assistance with something. Definitely pay attention to your breathing while you do these techniques. Of course, our breath is our life and it's our relaxation force. So we want to make sure we keep breathing while we're doing the treatment. You can also practice visualizations if that's something that you've learned to do. You can visualize the muscles softening, or you can visualize the chi flowing through, or the chi coming into the point like a golden light or a warmth or a heat. Okay, so let's get started. This is just a list of points that I wanted to provide for you that we're going to use today. So the first one we're going to do is on the ear. And I learned this technique from one of my mentors whose name is Tiffany Carol Pollard. And she is an acupuncturist who specializes in aromatherapy for acupressure. She uses the aromatherapy oil called bergamot. And bergamot is a citrus fruit. They use it in Earl Grey tea, and it's very uplifting and relaxing. So I have some bergamot here. You probably don't. That's fine. You could get it later, or you can just do this without the bergamot. But Shenmen is a point inside the pinna of the ear up here, and it's Shenmen means spirit gate in Mandarin, and it's a point for just relaxing the spirit. So typically we use our pinkies, and what I like to do, and I did it before our session today, is you just put a drop on a pinky, you rub your pinkies together, you might want to inhale it, it smells so good, and then you just hold your fingers very lightly. I'm using very light pressure here. I'm not pushing. And you can imagine if I'm lying down, I might be able to relax my arms out and just get more relaxed. Leave it here for about 30 seconds. So I can't see you, but you can see me hopefully. So why everybody give that a try. And just take a breath or two. Okay. So, and I have a link down here on this slide to a video where Tiffany Carol goes into more detail about why this is a wonderful technique to do for resetting any tension or anxiety or stress. Did somebody have a question? Thought I heard someone unmute. Okay, so let's use, let's do some neck and back points. So these points you're probably going to be pretty familiar with. In Mandarin, in acupuncture, we call them Ah Sure points, which actually means, oh yes, like, oh yes. And these are points that your body likes them and you feel good. I'm going to use these little tools that I have, which you can attach to a strap. I just have all kinds of gadgets, but you can use your tennis ball or whatever. And you're going to put, let's look at this picture here, this anatomical picture on the right side. So I would just like you to pick, well, let's all start with bladder 38. That's B38 here, that's inside the shoulder blade. So on the left side, you can see where the person's shoulder blade is on the back. And you're going to put the ball just inside the edge of the shoulder blade. Now, if you don't have a ball, but you have a corner, like you have the edge of a door frame or you have the edge of a chair or something like that, you can also use that. So we set the ball in the spot just inside the shoulder blade. And then you can kind of just move your shoulders a little bit, find a good spot that says, oh yeah. And then let it do its magic. Feeling your feet on the ground. Your breath in the belly. for about 30 seconds. You might want to move it around just a little bit. Sometimes I like to push it a little bit toward the shoulder blade because that gives a little bit of a good sensation for me. And let's switch to the other side, just inside the shoulder blade at bladder 38 there. It's right about the level of your heart. And if you're able to lie down, you can also do this point really well lying down using the weight of your body. If you're lying on your bed, it's not as easy because the bed has too much give. So lying on a hard surface works better for this. Sometimes I like to scooch down a little bit, go up a little higher on the back. You might start to notice that your shoulders feel tight, or you start to pick up on other areas of the body that are tight, because as this releases, it makes the tension in other areas more evident. Sometimes when I do this point, I get a shooting kind of tension release that goes all the way up over the top of my shoulder. That's called a trigger point pattern, and it feels good to me. So the next point, I'm going to have you choose one of two, bladder 10 or gallbladder 20. And both of these are up at the top of the neck where the big strong muscles that go up the sides of the spine come up and attach to the skull. So there's like a hole there that's out to the side, and that's gallbladder 20. And if you go in a little bit toward the spine, you can feel where those ropey muscles attach to the skull, and that is bladder 10. So here we just use our fingertips generally, although if I'm honest, sometimes I lie on the floor and I put a ball here for release. If you've ever done craniosacral therapy, there's actually something called a still point release where we use a tool, or the practitioner uses their fingers, and they release this muscular adhesion pattern here, and it allows the craniosacral fluid to flow more freely. And so you want to use a firm pressure, but not digging in too hard. And again, you know, you can also use your fingertips like this and come around and place them alongside the spine. And you can move and rotate, or you can hold. And today I'm noticing that when I hold, I actually feel more release. I think when I rotate, it kind of keeps me a little bit too amped up. There's also a point up at the top there. You can see on the diagram, it's a big, huge circle. This is kind of a bonus point. We don't have to do this as part of the protocol, but I wanted to tell you about it because, you know, you might find some relief from, instead of being to the side of the spine, from actually coming to the center. And you definitely want to be gentle in this spot because that's a delicate area where our spine attaches to our skull, and there's a lot of fine muscles there. But you might want to hold here or do some gentle kneading. So bladder 10, the name of that point is heavenly pillar. So you can imagine these ropey muscles, they're a pillar to heaven or a heavenly pillar. And then gallbladder 20 is called the gates of consciousness. I love those names. Next, let's go down to the wrist area. And again, you can use the ball on these, but the wrist is a very delicate area. So generally I just use fingers here. We have some nerves that run right inside the wrist. You might have zinged them before, so you know what I'm talking about, and they're pretty delicate. So we definitely don't want to dig in too hard here. But there's a point, if you take 4 fingers of your non-dominant hand, 4 fingers of your dominant hand, and you use it as a measure. So right across your knuckles, it's about 1.5 inches, 2 inches for most people. And then you take your hand, your other hand, and you find the wrist crease where it folds. I'll take my bracelets off because they're kind of in the way. And then you go from the wrist fold, and actually, sorry, it's 3 fingers, not 4. And you kind of trace down to where the 3 fingers end. And it's right between the 2 tendons that are there. They're the tendons that flex your wrist. So you trace it down. And again, in acupuncture, I have to be very precise here. But with acupressure, close is good enough. And this point is called inner gate. So you want your hand to be relaxed. So on the table in front of you, or if you're on the floor, you could rest it on your abdomen. And then just take your thumb and gently massage that area. It's called pericardium 6 or inner gate. And this is one of the very best points in the body for anxiety. We also use it for nausea. You might have seen some of those magnets that people get for seasickness or nausea. But it's definitely for anxiety and relaxation. So you just gently massage there. And if you feel a zinging of the nerve, you've gone too deep. And everyone's different. Some people just want a very superficial touch, and some people like a deeper touch. So you would do this on both sides. And I would suggest you choose either pericardium 6 that we just did, which is my favorite, or some people like this other one called Heart 7. So you can read about that one if you want and try that out as well. Face and chest points. This is one of my favorite insomnia acupressure. You take one hand, you place it over yin tang, which is between the eyebrows. And then the other hand you place directly between the breasts on CV17, which is conception vessel 17, which is the ruler of the heart. And, you know, again, it's better to be lying down, and you want your elbows supported. And this is more of a hold than a pressure. Although sometimes I find that if I put pressure on CV17 at my chest, it feels really nice, that pressure. And sometimes you might find that if you put your fingers directly on yin tang, this point between the eyebrows, that is also very relaxing. So again, you can experiment with it. And you hold them simultaneously. And with this hold, I find 30 seconds is sometimes not enough. And sometimes I just fall asleep. Just holding, you know. Okay. Foot and ankle points. These are on either side of the ankle, just under the big bone of the ankle. And what you want to do, if you're lying down, you can bend your knee and then just grab your the back of your ankle with both fingers. And so one finger is on the inside and one finger is on the outside. You can also do it sitting up. You can cross your leg. You can't see me, but I'm crossing my right leg over my left knee, and then I'm holding with my left thumb and pointer finger so that I'm getting the inside and the outside right under the ankle there. The inner point is called joyful sleep. It's just south of the ankle bone on the inside of the ankle. The outer point is called calm sleep. And again, it's just south of the ankle bone on the outside of the ankle. And you just need a light hold here. It's almost just a touch. And if you want to explore massaging, you can try that too, but I find just holding here is often enough for calming down. That's a great one for insomnia from menopause, by the way. Okay, and then the last thing I just want to tell you is that there is actually an insomnia point. And it's not really in the protocol, but I thought to tell you about it in case you want to practice with it. It's a little bit hard to find. It's between, there's kind of a hole underneath the earlobe between the jaw and the skull. And then there's the hole of GB20 that we did in the very beginning. And then right in between them, there's a muscle. I think it's the sternocleidomastoid that attaches up here to the skull. And that's where that point is. It's a little tricky to find, but that, again, with acupressure, you don't have to be perfect. You can just massage in that area. Hopefully you can see me. And that's called peaceful sleep. I think that point really works better with acupuncture, but now you know about it. Okay, we're almost done here. I just wanted to share some resources with you. This book here, Acupressure's Potent Points, I love it. It's very old school. It's kind of like a hippie book, but I think it's great. It has a lot of good pictures and protocols for different kind of things. Grasping the Wind, it's like a dictionary of all the point names, and they're beautiful. So I just think it's a beautiful book. The Web That Has No Weaver and Between Heaven and Earth are books about the philosophy of Chinese medicine and 5 elements, and so you could certainly check those out if you want to learn more. This is my mentor for the aromatherapy and acupressure and her website. And that's it. Okay, I'm only 4 minutes over. Thank you so much.
I find that our folks don't seem to mind when you all go over, because you're always sharing such wonderful information with us. Okay, so does anybody have any questions for Dr. Deirdre or Dr. Richard? You can unmute yourself and ask them.
I don't. I am.
Hello, I can't hear
Okay,
you.
I got it. Did you call on me?
Go ahead.
Well, I have fibromyalgia, so I noticed that most of these were sore, you know, and I'm assuming that that's normal for a fibromyalgia patient. Is that correct?
Well, it's a good point. I've never looked, because, fibromyalgia is diagnosed by certain painful points in the body, and I've never overlaid acupuncture points with fibromyalgia points. I would imagine that they overlay, but I don't know for sure. In Chinese medicine, we would probably look at it as blood deficiency, or depending on your constitution. But it is normal for these points that I'm showing you to be tender, and that's why you have to pay attention to your body. And if you find it, particularly with fibromyalgia, if it's painful, it's probably too much. And so you just need to really back off, and even just a light touch with no pressure can be a very powerful acupressure treatment. I know it doesn't seem like much. Or if you put an essential oil on your finger and just touch the point.
Well, are you making a distinction between pain and soreness?
Well, I think with fibromyalgia, it can be tricky because people with fibromyalgia, in my experience, have such a high tolerance to pain.
Oh, no.
Well, what I mean by that is that they've experienced so much pain that sometimes it's difficult. What I don't want is to aggravate something. And so you have to know your body and whether it's too much.
Whether it's a positive thing. Well,
exactly.
Different physical therapists have pushed different points. I've had CRT, and so people have been fooling with these things on me before. So okay, thank you. I'll just
well, no one knows better than you do.
I know,
it's your body.
I'll listen to my body whether I think it's a or a bad thing. Okay.
Great.
Thank you.
Thanks. Before the next person, I just noticed a chat. Someone said the slide says to hold pressure for several minutes. Is that a mistake? No, it's not a mistake, but I find with the points I shared with you today, 30 seconds to a minute and a half is usually adequate, but there's no problem with going longer than that if it feels good to you. Okay. Somebody else have a question?
Yeah, that was actually my comment.
Okay.
I have a question about essential oils.
Yep.
I've taken yoga classes where they put a drop of oil in your hands at the end and then ask you to smell it and relax. And so I bought, and I also been told that lavender oil is good. So I bought some lavender essential oils, and it says concentrated. Do not use undiluted on skin. Dilute to 3% in a carrier oil.
What brand is it?
And, it is Radiance.
I don't know that brand. Well, with this particular technique, we're not rubbing the oil onto the skin. We are just putting it on our fingertip and then holding it lightly against the skin. But certainly another way to do it would be to get a little tiny dish, put in some olive oil or some almond oil or some kind of carrier oil, and then add a few drops of the essential oil, and that would make it more dilute, so that particularly if you have sensitive skin or if you're not comfortable with this and you haven't done it a lot, that would take care of that. But the one that I use is very high quality, it's very concentrated, but I just use 1 drop on my finger and then I rub my 2 fingers together. So it's not a lot.
So can I or can I not uncap it and smell it?
Oh yeah, you can definitely smell it for sure.
And put a drop in my hand to smell?
Yep, absolutely.
Okay, that's all I wanted to know. Thank you very much.
Sure. Okay, who's next?
John, the question.
Yes.
For you or for Richard?
For Richard, either way, whoever.
Richard is still with us, so you can ask him a question.
Okay, first of all, Richard, is your, PowerPoint going to be available to us? I would like to read it. I would like to take time and read it.
I will, as soon as Richard emails it to me, I will share it with you all.
Okay, and Deirdre, you put on like organ meats. If you have high cholesterol, can you still eat a little bit of the organ meat? I think you are the
I mean, a little bit you can, but also I don't know you or your medical history, so I can't really advise about your cholesterol and what you should or shouldn't be eating. Generally, it's fine, but again, I couldn't really tell you without knowing you.
Okay, thank you.
So are there any vegetable sources?
Of zinc? Someone said
zinc?
Oysters, which I thought was a good one, but not really vegetable.
Okay.
Was that zinc? I thought it was selenium, but it was for selenium.
Selenium was Brazil nuts.
Brazil nuts, okay.
And oysters was zinc, which I had forgotten about. Yeah.
Okay, thank you.
Okay, so it seems
I wrote a question in the chat about the feet and the hands.
Can I ask?
Oh yeah, that's a great question. That's a great statement, GD, that there are a lot of pressure points in the hands and feet, and that you can just roll a ball under your feet or roll it into your hands, and it will really release a lot of the tension in the hands and feet. There's actually a kit that has been created, which is called the MELT kit, M-E-L-T, that my sister gave me, actually, of all things, and it's balls of different sizes and shapes, and then a little booklet to go with it that tells you different techniques for your hands and feet. It's a very cool little kit. It comes in a little bag.
Dr. O, can I ask a question?
Yeah.
The points that you went through, do they should they be done in an order before you're going to bed, or just...
I put them in what I considered to be a great order, but that doesn't mean it's going to be the right order for you. So I would say follow the order that I wrote, but then if you kind of feel like the flow is better in a different way, like maybe your hands want to go, you know, from you want to start on your chest and then go to your shoulders and then go to your ankles, you know, that's fine. It doesn't have to be a certain order.
Thank you.
Mm-hmm. The kit is called the MELT kit, M-E-L-T kit, and I have no idea where to get it. I'm assuming you could buy it on Amazon, but I honestly don't know. It's something that physical therapists usually sell, I think, or massage therapists. It's like, it's an acronym for something, M-E-L-T. I hope that some of you or most of you were able to get a little bit of relaxation benefit from the protocol today. I felt it, so I hope you did.
All right. Well,
thanks, Janet.
Thank you. And thank you, Richard.
Thank you.
Hey, everybody. That's another one under our belt. I hope you are feeling relaxed. I know you all are all eager to get the slides, so I will start working on that as soon as possible. But you all have a wonderful weekend.
Namaste.
Thank you.
Thank
Bye-bye.
you.
Thank you. Bye.
Thank you.
Bye now.
Bye.